Hello, lovely people. In conclusion, we started with a definition of shock, where we learned that shock occurs when there is diminished or inadequate supply of blood through circulation to body tissues, and this results in the reduction in the tissues receiving oxygen and then nutrient. And we went further to talk about the fact that shock would occur whenever there is an enlargement in the blood vessels, as in vasodilation, or whenever the brain tissues are being affected. So based on that, we can have so many causes of shock. And then we went through to talk about how to classify shock, where we said we can classify shock under two main categories: according to the time of onset and then according to the cause. And with the time of onset, we talked about whether it is either primary or secondary, and according to the cause, whether it is hypovolemic, whether it is cardiogenic, whether it is distributive or obstructive shock. Then we went further to talk about the stages through which shock can undergo, and we said these stages are interrelated and it is irreversible if not identified and then treated promptly. So the stages were mainly three, where we have the initial stage to be the compensatory or the non-progressive stage. Then it proceeds to the progressive stage, then finally to the irreversible or refractory stage. From there, we got to understand that as far as the internal organs and then the body function is concerned, we have the duration within which, if the tissues or the vital organs are being deprived of oxygen, the cells can die. So we talked of the major organ being the brain, which requires oxygen within some few seconds to minutes. And then we talked of the internal organs, where we have the heart, the lungs, the kidneys, the spleen, and then the others that would require not exceeding 90 minutes of deprivation. And then we talked of the musculoskeletal, which can sustain deprivation for some hours. From there, we went on to the management, where we said it is good to manage shock even where we don't identify the cardinal features for shock, than we not able to manage when actually there is a shock, because when it gets to the irreversible stage, nothing can be done about it and the individual would subsequently die. And we said as part of the management, we would want to manage the cardinal features. So we would manage the temperature by providing warmth. We'd want to enhance circulation to the organs by elevating the lower extremities within some stipulated inches, 8 to 12 inches. Then also we'd want to know the cause and manage it likewise. So if it is fracture, we manage it under fracture management. If it is hemorrhage, we manage it likewise. If it is burns, we manage it likewise. If it is infection or sepsis, we treat. If it is an anaphylactic shock, we treat the allergy, and then we are good to go. So thank you, and then we pray and hope that this knowledge gain would go a long way to help in your academic work and also help a casualty out there in order to save a life. It is better to know and not need it than to need it and not know, as the slogan of First Aid goes. Thank you very much, and we'll meet some other time. Bye-bye.